So 22 years later, the death count from 9/11 is still growing. That's because of cancers connected to that fateful day.
According to the CDC, 9/11 related cancers have more than doubled since 2013. Let's bring in Dr. Noa Biran for more on this. She's Associate Professor of Medicine at the Hackensack Meridian Health John Theurer Cancer Center. Dr. Biran, thank you very much for being here. So, that stat, we just mentioned it, shows that 9/11 cancers have skyrocketed over the years, with research showing firefighters who worked on the site of the 9/11 attacks having this extra high risk of cancer. First, tell us what type of cancer that is and why the risk is so high for first responders and survivors.
Yes, good morning. Thank you. So we know that people who are exposed to certain environmental toxins, such as jet fuel and other chemicals, have a higher risk of mutations, and that is what leads to the development of specific cancers. There are certain cancers we know are associated with a much higher risk, and those cancers are lung cancer and another bone marrow cancer called multiple myeloma. So not only first responders, but people who were in the vicinity of ground zero months or even more than months after the event are at much higher risk of these types of cancers.
So has this
far out? Yeah.
Oh, no, go ahead.
Even this far out, and the risk of these cancers continues to increase even 10, 20 years later.
Wow.
Has the rise in 9/11 related cancers impacted how we treat these illnesses?
So certainly there's a higher incidence of these cancers. The other thing to consider is there are other conditions that are kind of pre-cancerous. So people may have kind of what we would call smoldering myeloma or an inactive state of myeloma, and they're walking around with these for years. That are not active cancers, but we certainly need to increase monitoring of these patients in case their pre-cancer condition does develop into an active cancer. So we're certainly looking at these patients with caution.
And quickly, Dr. Biran, what resources are available to survivors, first responders who might be impacted by a 9/11 related cancer?
There's a World Trade Center health program that's available. If you have a condition that is proven to be associated with increased risk of cancer, or if your cancer is one of the 9/11 related cancers, then you are eligible for the World Trade Center health program. And your physician can help you in filling out the forms and get hooked up with one of the World Trade Center facilities.
Dr. Noa Biran, important conversation, important to keep in mind that this is still going on. There's still impacts. Thank you so much for joining us this morning.
Thank you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.